Hi, my name is Dr. Channa Amarasekera. I am an assistant professor of urology at Northwestern Medicine and the director of the Gay and Bisexual Men's Urology program. The Gay and Bisexual Men's Urology Clinic is a clinic that focuses on providing urologic care to sexual minorities. The clinic really started as a result of a research project that we took on a couple of years ago, where we were looking at disparities in care for different populations, and it turns out that there's a lot of disparities in urologic care for sexual minorities. So we started the clinic in August of 2021, and it's grown rapidly to our delight. And it's been a great place for patients to come and feel secure and talk about whatever it is that's bothering them. Yeah, we just published some research on what the gaps in care are for other providers in terms of what they know, what they feel comfortable about, and the work that needs to be done to educate providers. It was interesting because I think about half of providers felt that they weren't adequately equipped to care for sexual minorities. But there was a huge appetite for education. So a lot of providers, about 80% of them, said that they would like more information and they were willing to sort of learn, which is a really nice thing to see. Yeah, I mean, I think there's a lot that needs to be addressed from the very beginning. I think it's really important to collect data on who presents to your clinic. So if there's the demographics form where patients can include what their sexual orientation and gender identity are, that's really helpful. Just simple things like that don't exist for all clinics, so it's a matter of showing patients that you're welcoming and that this is a place that they could be who they are. I think that goes a long way in both welcoming patients and also collecting data to figure out where the disparities are. That's a very, very basic thing that I think can be instituted institutionally and across other clinics too. In terms of urology specific differences in care, I think what's different for sexual minority men is what they value in terms of quality of life with certain treatments. And if you don't take that into account, oftentimes you lead to a lot of dissatisfaction in care. So for example, if you treat people with BPH, a lot of the treatments we have now can affect ejaculatory function, which for sexual minority men might be more important than for other men. So sort of explaining what the different treatments are, which treatments are more likely to cause ejaculatory dysfunction, and which ones can spare it is important. And oftentimes we see a lot of regret in patients who've gone through treatment if they weren't counseled about the side effects of treatment, or if they weren't given the chance to explore other options that might have worked better for them. There are many different gaps in urologic care for sexual minorities. And something very simple to illustrate this is erectile dysfunction, which a lot of urologists see, and it's a very common problem. Even when it comes to measuring erectile dysfunction, the tools that we use currently to measure erectile function are very heteronormative in the sense that they are measuring erectile function for vaginal intercourse typically. And so it can exclude or make a lot of men feel like this is a clinic that doesn't really focus on them, or that they have to sort of transpose their experience to something else. So even collecting data on erectile function or sexual function for LGBT people, what currently exists doesn't really serve them. I think Pride Month to me is just a time to feel grateful for the people who came before, who sort of, laid the path for everyone else to sort of be open about who they are. And they did it in a time that was very different, and it required a lot of courage. So I think, this clinic just stands on the shoulders of all of those people who came before us, who really risk their livelihoods and their families and their happiness just so that everyone else could enjoy these freedoms.